Case study number 5. Summary. Sophia Martinez, a 50-year-old female. Sophia presents with chest pain, shortness of breath, and palpitations. She has a history of hypertension and hyperlipidemia. Current situation. Sophia arrives at the emergency department with chest pain that started 30 minutes ago and radiates to her left arm. She also reports shortness of breath and palpitations. Her vital signs are blood pressure 160/100ths of a millimeter of mercury, heart rate 120 bpm, respiratory rate 26 breaths per minute, temperature 36.8 degrees Celsius 98.2 degrees Fahrenheit, oxygen saturation 92%. Questions. Question 1. What are the potential diagnoses and pathophysiology for this patient? Answer A. Acute myocardial infarction (AMI/AM), commonly known as a heart attack, occurs when blood flow to the heart muscle is blocked, leading to tissue damage. Pathophysiology involves the rupture of an atherosclerotic plaque and subsequent thrombus formation. Key points include the need for prompt revascularization to limit myocardial damage. Answer B. Angina pectoris. Angina is chest pain due to myocardial ischemia, often triggered by physical exertion or stress. Pathophysiology includes reduced oxygen supply to the heart muscle due to narrowed coronary arteries. Management focuses on relieving symptoms and preventing progression to myocardial infarction. Question 2. What immediate nursing care is required for this patient? Answer A. For acute myocardial infarction (AMI), administer oxygen to maintain saturation above 94%. Provide nitroglycerin to relieve chest pain, and aspirin to prevent further clot formation. Prepare for possible thrombolytic therapy or percutaneous coronary intervention (PCI). Monitor vital signs and cardiac rhythm continuously. Answer B. For angina pectoris, administer sublingual nitroglycerin to relieve chest pain. Provide oxygen if saturation is below 94%. Monitor vital signs and assess pain relief. Educate the patient on identifying and avoiding angina triggers, and the importance of regular follow-up care. Question 3. What diagnostic tests and treatments are necessary for this patient? Answer. Electrocardiogram (ECG) to identify any ischemic changes or arrhythmias. Cardiac biomarkers, for example, troponin, CK-MB. To confirm myocardial infarction. Chest X-ray. To rule out other causes of chest pain, such as pulmonary conditions. Echocardiogram. To assess cardiac function and detect any wall motion abnormalities. Lipid panel. To evaluate cholesterol levels and guide long-term management of hyperlipidemia. Electrolyte panel. To monitor for any imbalances that could affect cardiac function. Medication information. Nitroglycerin. To relieve chest pain by dilating coronary arteries and reducing myocardial oxygen demand. Considerations. Monitor blood pressure and educate the patient on using nitroglycerin at the onset of chest pain. Side effects. Headache, hypotension, dizziness. Contraindications. Severe anemia, hypotension, use of phosphodiesterase inhibitors, for example, sildenafil. Aspirin. To inhibit platelet aggregation and prevent clot formation. Considerations: monitor for signs of gastrointestinal bleeding and educate the patient on the importance of daily low-dose aspirin. Side effects: gastrointestinal upset, bleeding, allergic reactions. Contraindications: active gastrointestinal bleeding, aspirin allergy. Beta blockers, for example, metoprolol. To reduce heart rate, blood pressure, and myocardial oxygen demand. Considerations: monitor heart rate and blood pressure, educate the patient on the importance of adherence. Side effects: bradycardia, hypotension, fatigue. Contraindications: severe bradycardia, heart block, asthma. Statins, for example, atorvastatin to lower cholesterol levels and reduce the risk of further cardiovascular events. Considerations: monitor liver function tests and educate the patient on the importance of adherence. Side effects: muscle pain, liver enzyme abnormalities, gastrointestinal upset. Contraindications: active liver disease, pregnancy.